Hello, Dr. Nikisha.
Hi.
Good evening.
I'm sorry for this. I'm not really very good at technicalities. So,
Okay, fine. Okay. So while you were not there, I have given a small introduction about you to all our viewers. So I would request, like now, you can also give a small introduction for you as well. So then after that, we can start with the live.
right. So, I have been in this field for more than like 15 years now. I am the founder of Prayatna Early Intervention Center. We have almost 5 branches in Ahmedabad with different versatilities. Like one we have with the neuropediatric setup, one we have only in the pediatric setup, one entire resource room in the school itself. We also do a lot of training for psychology. So we do a lot of internships, workshops. We train people such that they have enough knowledge to work with children with special needs. Also, in mental health industry, we work with all type of counselings and we do all kind of assessments. And yes, we're looking forward to have more branches in Ahmedabad now.
That is really amazing. That's great to hear. So yeah, you can just like I have a few set of questions which I will be asking you. So like if you want to start with some introduction part of your topic, you can just start with that and start asking you the questions.
Right. So today I'm going to speak about early intervention and how counseling plays a very important role while intervention is going on, while the therapies are on. You know, I have most of the time I have seen that whenever there is, occupational therapy going on, whenever there is speech therapy going on, the parents are undergoing different kind of changes. They are happy sometimes, they are sad due to some rejection from the school or somewhere. Um, at those times, if they are counseled at the right time, right from the first day throughout their journey, because it's a long journey. So they need to be assured, reassured. They need to know what is, what is important at what stages. And that's how I personally feel counseling is very important. And today's topic is how counseling helps early intervention, the families, and how counseling helps overall in autism. That's the topic.
Yeah, that's really great. Okay, so the first topic so the first question which I have, it is like, what is early intervention? Like, can you explain us like what exactly this term means?
Right. So, सीधे साधे भाषा में या if you talk it in phrase, it is a stitch in time saves 9. So, हम जैसे generally बोलते हैं that if you know about a concern, if you know about a problem, if you know about, uh, um, you know, any illness, if you know about anything that is bothering you in life, if it is addressed at the same time, if it is communicated at the same time, then we might find results early. And after working on those concerns, we are able to find a solution. We should be able to go through that path smoothly. So in our field, early intervention means intervening as early as possible with the child when we know that the child might have some developmental concerns or any other concerns which might not be age appropriate, which might not be behavior appropriate, which might not also be physically maybe appropriate. So in those cases, it is important to work on those areas as soon as the concerns have been recognized. So early intervention is just intervene the problem as early as possible, if possible, as early as recognized, or try to know more about where the concerns are.
Okay, that was great information about early intervention. Okay, so the second question is like, how early can intervention be suggested, and how does a parent know the intervention be needed?
Right. So, okay, intervention can be done as early as 3 months, 6 months. So
Okay.
we know now with Google Baba on hand, we know, every parent knows what development is needed to be done at what stage. right? Like, for example, at 6 months, not only will your baby, laugh and babble, it would give you a social smile, it would try and look at things whenever you are, the toys that you're giving him or her. So these small, small milestones that we are trying to reach for a baby at 6 months, these milestones are written anywhere on Google. Like, you just have to surf. The baby starts searching you, starts recognizing the mother, recognizing comes at a earlier age, but most of the times starts recognizing people also around, right? Even sleep ka length long ho jata hai, so then the child is able to sleep longer, the mother feels relaxed, the mother has a, so these changes when they come, right? And when they come in naturally, right, then we are not worried because the developments are happening on time. Now, in case if we realize that the baby gets excessively cranky, or the baby is unable to wean off to, small, semi-solid foods also, like let alone the solid food, but semi-solid food also, or sometimes the baby is crying the whole night. We don't know the reason why, sometimes they say it's colic pain. Sometimes, the parent keep on thinking what it could have been, but the baby is crying for the full night. So some comfort which is not proven by discomfort, which is not proven by the doctor. So when they go to the doctor, the doctors would say, "Nahi, baki sab to theek hi lag raha hai." So, but because the developments are not being communicated to the pediatrician at that point in time, if the parent can be well aware of what development needs to be done, progressed at what age, then we are talking about how how important it is to intervene at the right time. If we are talking about generally who suggests it, so if we go to our, generally we do in India, most of the people believe in vaccinations. So if you go for vaccination and if you talk to the doctor about the developments, if you're an aware parent, if you know that these are the developments or these are the milestones that my child has not reached, then in those cases we would request the parents to go and speak about it to the pediatrician, to talk to them, to ask them that abhi tak ye nahi hua, ya bachcha back and front nahi ghum raha, ye 6 mahine pe generally bacche karte hain, right? So see, if the child is doing like 10 things out of the list of like 15, then also we can give it a pass, right? But then if it's not doing like even 2 or 3 things out of the list of 20 or 15, then that's where the parent needs to be more concerned, needs to be more proactive. I would request the parents that if they're seeing the developments on Google, don't start seeing the solutions on Google. Please visit the right doctor, visit the right place, talk to them about the child's development, learn what is the right path towards getting their developments correctly, such that you don't skip any important milestone. So most of the time, intervention is suggested by the doctors if they feel that they are not, the child is not developing age appropriate, and most of the time the parents also do come directly to us because they know that the child has a delay. So yeah, most of the time early intervention works in that fashion. So that's how it actually works. Also, yes, if the child has started going to the school, right, then the school teachers also send it. So there is a lot of awareness now most of the time, and also because the teachers might not know what exactly the child's concerns are, but teachers generally figure out कि ये बच्चा कुछ तो age appropriate नहीं है, एक जगह बैठता नहीं है या ठीक से देख के बात नहीं करता. The most common concern that we have come across is हम जो भी बोलते हैं उसको repeat करता है. Echolalia is the most common concern that the parents, that the teachers come up with, and the second very common concern is the child does not sit at a place. So when this child has been referred from the school, right, so then most of the time these are the so these are like you can just say these are the symptoms. They just see this, gather this, and then they tell the parent कि हमें ये सही नहीं लग रहा है. Parents से ये request बनता है कि whenever the school comes up with such concerns, please don't feel that school को तो क्या है, हम इतने पैसे दे रहे हैं, we should not, I think that this is not the correct way of talking to us. The school does not want to take care. No, if the school does not want to take care, then I don't think the other 20 children would have been taken care of also, because every child has some concerns or the other, there has to be something where the child needs more attention, extra attention, and the teacher is unable to give or unable to do justice to the child. That guilt also tells the teacher to, sense the difficulties of the child, and then finally send the child to an early intervention therapist. So
Yeah.
that's how early intervention happens. Yeah.
Okay. So why is developmental assessment more recommended than psychological assessments, like especially for children less than 7 years of age?
Okay. Yeah. So psychological assessments are assessments mostly which we do with the intelligent quotient, the IQ of the child, which I recommend that जब cognition, जब developments ही time पे नहीं है बच्चे के, तो intelligent quotient का क्या ही कर लेंगे हम लोग? How does it matter
Yeah.
that the child's IQ is average, dull, normal? How does it matter? Because the child has not been given practice in a certain format to relate to the environment. And when the child has not been given a certain practice, then also when the child is delayed development, there is no way the child will sit and give us accuracy for IQ. IQ galat hi aana hai bacche ka. Psychological assessments does not give the correct accuracy or the level of the child, when especially when the child is autistic. Because क्या होता है, पहले ये terms use होते थे, high functioning, low functioning. अब तो the DSM doesn't use these terms, but sometimes the arousal level of a child is so good that he or she would do like brilliant during the IQ session, and the same child on another day might just not perform. Right? So in this case, how does an IQ, how does an intelligent quotient of the child, become the face of that child? Because बहुत बार ये हो जाता है कि बच्चा ना डल नॉर्मल है, फिर उसको उसी हिसाब से देखा जाता है. But especially in autism,
Yes.
also in most of the other developmental delays also, in Prayatna, we never recommend psychological assessments unless and until the child is in the 4th standard. And वो भी स्कूल मांगती है, तो ही हम 4th स्टैंडर्ड में, हम तो भी 1 साल टालते हैं, पेरेंट्स को बोलते हैं थेरेपीज करो, 5th स्टैंडर्ड तक देख लेंगे IQ कैसे आता है. बिकॉज 5th में देन द सेन नीड्स कम्स इन पिक्चर, द स्पेशल एजुकेशन नीड, द CBSE entire that unit comes in the picture, where we have to say that the child has special needs, and then the child might need some special concessions from the CBSE board. इसीलिए 5th में करना साइकोलॉजिकल असेसमेंट जरूरी पड़ जाता है. बट मेरे हिसाब से अगर बच्चा 4th स्टैंडर्ड तक है तो डेवलपमेंटल असेसमेंट्स करिए. डेवलपमेंट असेसमेंट्स में actually there's an entire column where the child has been assessed in terms of his fine motors, gross motors, cognition. To specify what cognition is basically our thinking skills, how the child would react at a certain age to certain things is cognition. So the cognition has been the general average आता है. ये एकदम exactly नहीं बोल सकते. हम ये बोलते हैं कि the child's cognition is from 15 months to 25 months. इस तरह से हम लोग we give an average of whatever is the cognition of the child. So all these things, the developmental assessment के जो अलग-अलग parameters होते हैं, उसके basis पे बच्चे को then जो उसका क्रोनोलॉजिकल एज होता है और जो उसका डेवलपमेंटल एज होता है, उसके बीच में जो भी गैप है, वो जनरली वी स्टार्ट विद ऑक्यूपेशनल थेरेपी, एंड जनरली उससे वी therapy, because occupational therapy generally helps the child to get in body posture, the proprioception, and him being with respect to prefer to psychological assessments. And I guess I've mentioned enough about why they were more important.
Yes.
Yeah. So I would request the parents to get the child developmentally assessed rather than psychologically assessed. Yeah.
Okay. So then I'll just go quickly to the next question. So why should counseling be needed before and after the assessment?
Okay, yeah. So before the assessments, yes, because the first when the parent comes and meets, so most of the time the parent will come and they will say, "Okay, speech concerns hai," and the child is not speaking. Most of the time they will come and say this only, that the child is not speaking, because unless and until they are made to realize the other observant areas where the child might have concerns, the only area that they feel the child would have a problem is speech. So before the assessment, it becomes necessary because the parent needs to be abreast of all the concerns of the child apart from just the speech. The parent, because of course assessments honge to delay aayega, developmental delay aayega. Most of the time we don't until 5 years write that the child has autism. We just generally write the child is developmentally delayed and we try to bridge in the gap. But if that does not happen, then we need to first prepare the child, prepare the parent, that after the assessments we would be able to tell you what the child is facing, what are the concerns. But according to us right now, before the assessment, we generally do a short screening wherein we tell the parent that he's this is his age and he's already not doing these things. So to convey that in a proper manner, in a proper fashion, such that they do not feel, because most of the time the parents feel, there's a very common feeling that why me, why
Yeah.
my child. So but then we keep on telling them that we have many children who come to us at 2.5, 3, and then they go to a normal school. They don't even need inclusion. Then they are a part of, they are there, they are a part of the entire social system that we have. So this reassurance that your child will get there before the assessment, such that the entire procedure then starts going in smoothly, is very important. So before the assessments, of course, to just let them know and just let them get mentally prepared that what they are in for. And after the assessments, counseling is important for them to know what kind of therapies are needed. Why initially, अगर बच्चा बैठता नहीं है एक जगह पे तो तुरंत स्पीच में नहीं डाल सकते हम. बच्चा आई कांटेक्ट नहीं देता है तो तुरंत स्पीच में नहीं डाल सकते हम. आजकल देयर इज अ टर्म एबीए जो बहुत निकला है, एंड वी हैव मेनी पीपल कमिंग अप एंड सेइंग दैट एबीए इज इंपॉर्टेंट. Yes, but then the child is not understanding anything. There's no sense of no awareness at all, right? So I feel that until that awareness doesn't come in the child, it's difficult for the child also to go through so many therapies. So I generally recommend one therapy at a time, mostly occupational therapy being the first. And then once the child settles in with the process of therapies, then once the speech starts coming in, we might introduce speech. But speech, again, I feel that is the best thing is, if we give you a home program, the parents should do the speech therapy with the child, such that it becomes a regular process throughout the day. So that's how we generally do. So, but after the assessment, if we counsel the parent in such a way that this is the process, and most of the time you will get through to this process. It is, no doubt, it is hard work, but hard work will pay. So that's why I guess counseling is needed at both the ends.
Okay, that's great. Okay, so what role does counseling of family play in the development of the child?
Right. So most of the time I've seen that for the assessments, the parent will come. So we have the mother, the father, sometimes the grandfather or the grandmother, we have them coming in. But then during the process of therapies, we have just one caregiver who will generally come for the therapies and go. I feel that, see, it is a process where the parent might, the person who is the caregiver, the most the most primary caregiver, might feel overwhelmed with this entire process. So if you have the entire family as one whole unit to work towards the child, wherein they can take turns. I might not say that take alternate turns, but at least week mein ek baar, if the primary caregiver gets a break towards being with the child and doing different activities with the child in the house, outside the house, so that the entire feeling, because mostly मैंने देखा, if the mothers are coming with the child for therapy, the mothers take it as a task कि अगर बच्चा बोलेगा नहीं तो I might, it's my failure. So which I feel, if mothers don't work, it's not going to the hard work does not pay off. So the mother taking that that thing on her and then working towards the child definitely helps. But then in the entire process, it takes a great toll on her. She's not understood by the family because there are times she might not be, she might not do the needful for the husband, or might not do the needful for the family, maybe the grandfather, the grandmother of the family. So in those cases, if the entire family knows what this entire process takes, and how much of hard work it goes inside, uh, it's always, good for the primary caregiver, so that they can all work hand in hand towards the development of the child. That's why the family counseling plays a very important part. We do have at Prayatna grandparents coming in to understand what to do at home, because they cannot come every day to therapies, but then at least at home they do certain things so that the child also gets different people to work with. So that's how it helps.
Okay. So my next question is, how does counseling help the primary caregivers?
Yeah, so as I just now said, so it reduces the stress of primary caregivers, because if the family does not understand this process, right? Like if I enter my intervention clinic, and if I have parents sitting for therapies, and if I have 4 mothers, at least 2 will tell me, Nikisha ma'am, 2 minute baat karni hai aapse. So they will just come, they will talk about, अब जैसे अब ये बच्चा ये नहीं कर रहा है, या पहले वो ये करता था अब ये नहीं कर रहा है. And when they come to know that this is, like, sometimes regression is a part of the therapy. The child might regress and then suddenly might show progress, and these stages are normal. So when they know that what they are in for, that their anxiety reduces. And if they don't get the entire support from the family, and if they are alone, then counseling at right time, at the right intervals for the primary caregiver, gives them a lot of exposure towards what to expect from the child and what to expect from themselves towards working for the child. So in that entire process, they remain relaxed, at least try to remain relaxed. I can't say they do remain relaxed, but they at least try to remain relaxed. So if they have a person who can hear their concerns, their agonies, their pains, just simply hear it sometimes, it definitely helps reduce the stress level of because otherwise तो mental health concerns होने ही है, anxiety होता है, panic होता है parents को. So that becomes a part of that entire process then. So that's why I guess counseling plays a very important role in right from the time the child has been detected by delayed developments until the child is in therapies, goes to school, because school से भी बहुत कुछ आता है. बच्चा लिखता नहीं है, बच्चा ये नहीं करता, बच्चा वो नहीं करता. So जो नहीं करता है वो पेरेंट्स सब हमारे पास ले आते हैं कि मैम अभी वो ये नहीं कर रहा है, अभी वो ये नहीं कर रहा है. So if it is talked out at the right time, then it definitely helps. Yes.
Okay. So how does counseling help in the ongoing process of therapies?
Okay. So like I just now said, during the ongoing process of therapies, most of the time, the parents are asked to sit out, the therapies are going on inside, and the parents most of the time don't know what is going on in the therapies. Though in Prayatna, we have a system where, we have a website where the parent can log in and what time the child came, what time went, what did the therapist do, all that is there. But then, कैसे exactly होता है, ये जानना उनके लिए थोड़ा we might not tell them the entire thing because हम कुछ एक करते हैं, फिर the parents try, and then that goes in a different direction. So during the ongoing therapies, if the parents know what is the plan of the child, what is the early intervention plan of the child, at what areas we are working on, and what is the help that we need from the parents, because finally therapies में तो 45 minutes आएगा, अगर 2 session के लिए आ रहा है तो 1.5 घंटे के लिए आएगा. So if we tell the parents that if the child behaves in a certain way, try to do this so that the child might feel relaxed or less stressful. So small tips given during the therapies, during the ongoing sessions of the therapies, or wherein we can tell the parents कि बच्चे से क्या expect करना चाहिए, and हम जो plan बनाते हैं उसके लिए उनको घर पे क्या करना चाहिए, because we definitely need their help. Most of the parents, if we send videos, मैंने ये देखा है, हम जो puzzles use करते हैं सब वही चीजें घर पे लाके रख देते हैं और वही चीजें बच्चों से वापस भी करवाते हैं. So that's when we encourage the parents to use home things, like things जो घर पे पड़ी होती है, घर की clips use करो, घर की कटोरियां use करो, घर की चम्मच use करो, घर की dish use करो, घर के काम में बच्चों को engage करो. सो बहुत रिक्वेस्ट करते हैं पेरेंट्स से कि ये सारी पजल्स मत लाओ, हमें लानी पड़ती है क्योंकि वी आर अ सेटअप, यू नो, वी कैन डू इट इन डिफरेंट वेज. You don't start doing therapies with the child. So if the otherwise the child is going to get burnt out, you know, if घर पे भी थेरेपी हो रही है, बाहर भी थेरेपी हो रही है, घर पे भी एक ही जगह बैठ के सब हो रहा है. So to let the parent be aware that the process of therapies can be done differently in a playful manner in the home setup. That's exactly why I feel that, you know, the parent counseling plays a very important part. Once the parent, you know, initially it plays very 2-3 महीने तक, yes, it plays a very important part. Then we generally meet the parents when the parents will, you know, ask कि मुझे मिलना है, तब हम मिल लेते हैं. But starting 3-4 महीने तो हम regularly मिलते हैं parents से, so that we can tell them that ये सारी चीजें घर पे मत करो, do it differently. So that's how we counsel the parents during the ongoing sessions.
Okay. Great. So I will be just asking you the one last question. So Prayatna has a resource room in a CBSE school. So what is the role of counseling in inclusive schools?
Right. Yeah. So yes, we do have an entire resource room in one of the CBSE schools here, and counseling plays a very important role there because see that's an inclusive school, but most of the parents will feel that, you know, नहीं मेरे बच्चे में तो कोई concerns नहीं है, सारे बच्चों में बिहेवियर इश्यूज होते हैं, या फिर बोलेंगे कि सारे बच्चे स्लो लिखते हैं, या कितने सारे बच्चों की बुक्स कंप्लीट नहीं आती, मेरे बच्चे को ही क्यों पिकअप किया गया. सो व्हेन दीज थिंग्स the teachers there are unable to answer these questions is when a counselor comes in picture to let them know that दूसरे बच्चे जो बुक्स कंप्लीट नहीं करते हैं वो शायद अपने मर्जी से नहीं करते. दूसरा एक बच्चा है जो बुक्स करना चाहता है कंप्लीट लेकिन वो कर नहीं पाता है. सो टू थिंग्स, यू नो, द चाइल्ड इज अनेबल टू डू, द चाइल्ड कैन नॉट डू, और द चाइल्ड डज नॉट वांट टू डू. If the child does not want to do, then the school cannot, like, you know, force the child to do it. Then that is some you can say behavioral concerns, a child's dislike towards studies. That's when we don't play a part. But when the parent is working hard towards the child, when we know that the child wants to do something in the class but is unable to do, you know, इसकी capacity नहीं वहां तक पहुंच रही है, in such cases to keep the parent abreast of these are the concerns, you know, and this is the concern that we are facing, and how we can take your help in making the child, you know, appropriately, you know, inside the classroom, appropriately inclusive in the classroom, is when we need counseling with the parents. Of course, with teachers also a lot of counseling goes for them to tell what could be the plan for the child, for them to, you know, understand how to make that child feel inside the class, and yet make him do a separate curriculum, because बहुत बड़ा task है teachers के लिए भी, you know, in the class of 20, 25, 30 एक बच्चे को separate लेकर बैठना बहुत डिफिकल्ट हो जाता है. नाउ दैट आई एम इन द स्कूल, आई नो कि कितना डिफिकल्ट है वो प्रोसेस. सो उन सारी चीजों के लिए, और ऑल्सो कि जब बच्चा स्लो है या बच्चे में कोई कंसर्न है या ADHD है या LD है तो बुक्स कंप्लीट नहीं होती बाय द एंड ऑफ द ईयर, देन द पेरेंट्स माइट आस्क that what did you all do, why didn't you all tell me before a year started, you know. That's when counseling plays an important part. At least we let them know that these are the concerns. If the parent is ready to work with the child in the right direction, most of the time they are, and then they would get their assessments done, and then we can work in a certain direction, and then we tell the parent that these are the areas where we should find improvement, and these are the areas where he might not improve much, but we will try. So that's how it works in the school environment.
Okay, so that were all the questions which I had for today. So there are some things in the live, like someone is asking, like, can you give me a program?
Right, give you a program as in, see, for giving you a home program, it would always, I would need to know the child's age, the child's cognition level, what does the child do, how does the child perform, what are the primary concerns of the child. So home program, yes, we do give. But unfortunately don't do assessments online. There are people who do online, and but Prayatna is still not, you know, we feel that seeing the child, watching the child in an area is very important. I would not sign an assessment report unless and until I'm not sure about what I'm giving to the child. So yes, if you can get him once to Ahmedabad, and at least once, if I can see the child and get him assessed, then we can give you a home program, and then after every 15 days we can meet online to to keep revising the home program. And during the home program, the parents generally do send us the videos wherein we most of the time come to know what the child does. And the next consultation, we talk to them about what the child does and what is his abilities, and then we keep on revising the home program. That's how we do it.
I will ask our viewers to ask any questions if they have. We might wait for some moments. So in short, it was a
He
great.
also asked, can you send for me what I can do with my child at home? Okay, yeah. So that's the home program he's saying. So yeah, if you can send me your details on my mailbox or, my Prayatna's number about the child and just one assessment coming here in person. So we do have people coming, from abroad also. We have people coming from UK and Australia here in Ahmedabad for therapies. So just one assessment and then we start giving them home programs and it works.
That's amazing.
All right. So he's writing that the child is 4 years of age and he has deficit of attention. Thank you for that information. But again, that information is not enough because I need to see at 4 years what are the different developmental concerns that he has, which makes me feel that the child has deficit in attention. Considering attention deficit is a symptom, but what is the actual concern? जैसे अगर मलेरिया होता है तो ठंडी आके बुखार आता है तो मैं ठंडी आके बुखार देखती हूँ फिर डॉक्टर के पास जाती हूँ ये जानने के लिए कि मलेरिया है उसके लिए तो आप मुझे जो बता रहे हैं वो सिम्टम बता रहे हैं डेफिसिट ऑफ अटेंशन बट एक्चुअली डेवलपमेंटल में कहाँ कंसर्न्स है कि अटेंशन में डेफिसिट है तो उसके लिए तो सर आपको एक बार लाना पड़ेगा हमारे पास I guess he's got his answer now.
I hope share your details like here on the live. So maybe if anybody wants to contact you, they can directly get in touch with you.
All right, wait, I'm going to do this. 1030104045. This is my Prayatna admin's number. I've done that.
Great. I hope if anybody needs help or they want to consult her, they can just use the number given below. Great. I hope there are no any more questions. So hopefully if we are good to go, we can just, okay. He liked to run too much. There's one.
So again, sir, you're giving me a symptom only. I need to really know that why is he liking to run so much. I would really request you to please come over and take an appointment from us because this information is really not enough for me. I need to know the child completely. And now that I have put my phone number, feel free to call upon this number and take an appointment. Thank you very much.
Great. So I think we are all good to go. It was really an amazing session with you. And I hope that everyone has got the best knowledge from you, and I hope we can have some more lives in future as well.
Sure, we should do that. We should definitely do that. Yeah. Thank you so much for having me. It was a pleasure. Absolutely.
Actually, we are more than thankful to have you on board with us. Like, it was really an amazing session, and the information which you have shared was really good for all the parents. Like, I can see people are really commenting. One parent is really eager to know a lot more. So I will request you, sir, to contact her directly, and then you can get all your queries get solved. Okay, then I just end the live, and I hope everyone enjoyed watching the live, all the information. So thank you so much, and
thank you. Looking forward to meet you again, Kruti. Bye-bye.
Yeah, oh, sure. Okay, bye.